Dr. Shilpa Dass. I'm a pediatric neurologist and fellowship-trained neurodevelopmental specialist, and today we're going to talk about dyslexia. A common question I get is dyslexia genetic? And I want to answer that, but first let's talk about what dyslexia is. Dyslexia is a true learning disability that affects a person's ability to decode written words. Dyslexia is not an issue with vision or with intelligence. In dyslexia, a person's brain has difficulty with sequencing letters and also with pairing a certain sound to a certain letter, which is what phonics is. People with dyslexia can also have issues with writing, with reading comprehension, and also with spelling. But not everyone with dyslexia has these issues. So is dyslexia genetic? The inheritance of dyslexia is actually multifactorial, meaning that there are multiple things that can contribute to a person having dyslexia. There is a strong genetic component to dyslexia, and like other neurodevelopmental disorders, it does tend to run in families. But we know there are many genes that are associated with dyslexia, and studies have confirmed that having a dyslexic parent puts a child at higher risk of dyslexia as well. Dyslexia is quite common, and studies show that about 20% of children have some form of dyslexia, so it's really important to identify early. It's important to remember that dyslexia is not something that children grow out of, so getting a diagnosis early so you can start strategies to improve reading early is crucial. But studies are showing that there is some evidence to environmental risk factors also playing a role in the person developing dyslexia. An environmental risk factor means that the surroundings a child grows up in or certain exposures during early brain development can affect the expression of certain genes. Studies have shown that things like exposure to cigarette smoke in utero, maternal nutritional deficiencies, and growing up in a highly stressful environment may affect the likelihood of developing learning disorders such as dyslexia. So take-home points are that dyslexia is an issue with decoding written words. It's quite common. Up to 20% of children have some form of dyslexia. The earlier we identify dyslexia, the better the outcomes, and that yes, there is a genetic component to dyslexia, but studies are starting to show that there may also be environmental risk factors that can affect a child having dyslexia.